can come without any warning, but if you think you might be having a heart attack, you need to act fast. Doctors say one of the first things you should consider is dialing 911. It's a phone call no one wants to make, but those 3 numbers could save your life.
Dispatch may help you.
They are always there if you need them. But doctors say all too often people who suffer a life-threatening heart attack don't pick up the phone when they should.
A lot of people are reluctant to call because they don't want to be a whiner, or they don't want to exaggerate symptoms that they think might be heartburn or just be reflux symptoms. The actual damage would be to the muscle.
Dr. Mike Subocz, a cardiologist at Southwest Washington Medical Center, says the symptoms can come out of nowhere. Tightness in your chest, arm pain, back pain, and weakness. Symptoms that should not be ignored.
If you think you or your loved one is having a heart attack, definitely don't bring yourself to the hospital. If it seems like a real acute situation, call the paramedics, call 911.
Dr. Subocz says it's critical that patients are in the hands of paramedics who can treat them on the spot.
A big mistake would be trying to drive in and possibly having an arrhythmia or just blacking out on the ride in. There's not much you can do for your loved one if they're in the passenger seat unconscious.
In the case of a heart attack, minutes can be the difference between life and death. That's why doctors say some of the best advice they can give is don't be afraid to dial 911.
Than to miss a heart attack. I mean, if you stay home, your heart gets damaged, you've lost some heart muscle, and that's something you can't ever get back.
Well, doctors say another good reason to call 911 if you're experiencing heart attack symptoms is that the ambulance crew can make sure you're taken to a hospital that's equipped to care for heart attack patients to avoid any delays in treatment. Doctors also say it's better to be safe than to risk any damage to your heart.